In this video, a leading dental implant surgeon from Costa Rica discusses why people prefer two-stage implants over immediate loading.
Basically, I think why people are still using a lot of the two-stages implant and doing a lot of surgery to place an implant, it has to address for two reasons. One is they were trained to do that, and it's difficult after, especially if an implantologist went to school for an extra 2 years or 3 years just to place implant. When they see such an easy procedure on placing it, I mean, it doesn't justify all the studies that they did. So they like, and there's people that they like to see blood, and there's people that like to really cut in and see the whole thing inside and do stitches and everything. But that's just one reason. The other reason, I think, is just because the big companies doing the implants invest so much money on them in selling the product as a two-stage implant, and for one reason only. It has to do because we end up buying more appointments and more stuff just to place a two-stage implant, and that involves in more money. And they have to justify also their costs and the way that they sell and do the whole structure under it and the teaching and everything. They have to keep doing it because there's too much money involved. So a lot of the treatments were controlled by big companies because that's the way they were trained and that's the way they planned to sell their product. But the reality is that the simplest way of placing it, and it makes sense. I mean, if it's easier for me to place an implant, and it's easier for the patient to recover after the implant, and also it becomes easier for everybody. At the same time, we can actually lower the prices and make it more affordable to a lot of people. I think dentistry for the maybe last 70 years, 80 years, or maybe more, was developed more for a 10% of the population that had the money to pay for it. Nowadays, we're seeing that it's changing a little bit, and we want to say that it's getting more affordable for the rest of the 90% that cannot afford it. Because it used to be that all these people that didn't have the money to do this latest technology, what they did is just pull out teeth and do a denture or do a partial, and that was it. Or sometimes they will stay with nothing because it was too expensive to reach the next level, which it was place an implant, place a crown, place a bridge. Nowadays, especially with medical tourism, we're able to give that technology to more people. Not only in our country, in Costa Rica, we're able to reach more people in the United States, in Canada, and Europe, because we're giving the same technology that was unaffordable or was unreachable for a lot of people, making it possible for the same kind of money that they were paying for the simple dentistry.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote and more information.